So yeah, without further ado, I'll pass over to our speaker this evening, Eleanor.
Hello, nice to see you all, and thank you for joining tonight. So I'm Eleanor. I'm nature-based wellbeing manager at St Nick's, and St Nick's is in York. We call it the Green Heart of York, so it's a local nature reserve in York. My background is social work and advocacy, and I suppose the practice that I've developed over the years informs the work we do at St Nick's. So we pride ourselves on being person-centered and strengths-based. And so tonight we're looking at how we do this in practice and how we stay in line with the values of our charity, and we meet the needs of the funders. So St Nick's, I don't know if anybody's come across St Nick's before. It's an environmental charity. Let's say it's in York. It's on a former tip. It's quite an interesting site. So we maintain the local nature reserve there. We have an environment centre. We do a lot around conservation, education and community engagement. As well as managing the local nature reserve, we also develop the green corridors across York. So there's lots and lots of green areas, and part of what we do is try to connect those up for nature to improve wildlife across the city, and obviously as well that improves our well-being as well. So we manage the nature reserve. We deliver ecotherapy as part of our nature-based wellbeing offer. We have green volunteering programs with our Green Corridors team, and we also have a recycling team. So if anybody's familiar with the recycling in York, you might see the little electric vehicles going around the little streets of York. And we're quite proud of that service because we sort everything by hand. We know exactly where it's going, and it's ethically recycled. So it's quite a different charity, but at the heart of it is the environment. This is a little bit of in terms of what our nature reserve looks like. And what we say is that we're creating thriving and connected biodiverse communities. So everything that we do around the charity is to connect things up for better biodiverse wildlife, really. So this is what we do on our nature-based wellbeing program. We offer a program of group activities throughout the week. And these group activities are to improve mental and physical well-being. Our USP is the nature reserve, and everything in our groups is nature-based. So regardless of what the group is, whether it's a book group, whether it's an art group, whether it's I don't know, eco-crafting, it's all around nature. So we're supporting people in terms of their mental well-being, but we're using nature to do that. So what we say to people is, come along, come and connect to nature. We say, come and park it at the gate. So the people that we're supporting generally are really quite poorly. They often have quite severe and enduring mental ill health. And coming as part of the programme there, we use the nature reserve and the environment to improve that well-being, to create a safe place for them, somewhere that they that's calm, that's positive. They become part of our community. They feel included, and they're very much an individual. In order for them to be able to come and connect to those groups and be part of those groups and focus on nature, we offer one-to-one mentoring. That mentoring is available to all. It's very flexible. And what it means is that rather than the group starting to focus on the challenges that people are experiencing, the mental ill health that they're experiencing, they can come and they can be in the group knowing that they've got that provision. And that provision is really flexible, so people can access it fairly spontaneously on the day if they need it. If somebody turns up on the day and they're in distress or they're having a tough time, they will be met with a member of our staff, and they will offer that support and that mentoring. So it's quite a flexible approach that we have, and quite a responsive service that we offer. And we started from a point of looking at what was lacking, what was missing across the city. We wanted to be innovative and to be pioneering something different. And we realised that we'd got the nature reserve that we could do that, but in order to be able to, for people to be able to access that and feel the benefit, we need to be able to offer something different as well, something alongside that. So we did a lot of research into how that should look, and we also did a lot of research into what the barriers to engagement were. For a lot of our people, they've been in and out of services for many years, sometimes 30 years, 40 years. There's a lot of mistrust around services. Sometimes they can feel that they've had harm done to them. So we knew that we needed to be person-centred, we needed to build up that trust, and we needed to offer something different. And that's what we've tried to do. So how we've done that is we've started from a point of view of making the service fit the people that are coming to us, rather than them having to fit the service. And that's quite a different approach. It takes a lot of work, a lot of flexibility from our staff, but that's the starting point, is how can we make this work for you? So when we're meeting people for the first time, when we're in contact with people for the first time, we're already starting to say, what are the barriers? What would make this too hard for you to come? We want you here. What's going to stop you from getting here? And we're starting those robust and those honest conversations, early doors, because we genuinely want to know. And for some people, it might be, I'm not going to get through that gate on my own. So if we know that, we can say, okay, well, we'll meet you. We'll send a member of staff and we'll meet you. You text us and we'll meet you. So it's things like that where we start from the initial introductions of, what are the barriers? And then we're also very flexible in terms of our pathway, our timings, the support that's needed across the programme. So we know that coming in the first instance is really hard. It's taken a lot for somebody to pluck up the courage to come to us, to make contact with us. So we also know that person's an individual. For one person, it might take 1 or 2 weeks to start in the programme. They might be ready and raring to go. We meet them on the Monday and they're in the programme by the Thursday. They can't wait. And that's fantastic when that's the case. But we also know that for quite a lot of our participants, that's not the case. They don't know us. They don't know that they can trust us. We might be like everybody else, like every other service. And they're waiting to see what we'll do, to see how we'll show them that we're a little bit different. So for some people, it might be that it takes several weeks. We have to slowly build up that trust, and we do that. We have staff that will work alongside them, building up the relationship, introducing them to the team, to the building, to the charity, and to the community, and they'll take that time. And there's flexibility, and it might be that there's 2 steps forward and one step back. It might be, sometimes it can take months. Sometimes somebody will come and have a taster session and then be quite nervous, quite anxious, and take a step back again. And we're alongside people for that. We know that that's difficult. We also know that life gets in the way. We have good days, we have bad days, we have life events happen. So we get that. It's an open door, and it might be that at one point it's too much, and then several months down the line it's okay. It feels better. It feels doable. And we are keen with how we engage with people to show them that that's okay, and we understand that. We get that. There's no judgment. We're not going to be upset. we make a real point in terms of all our assessments to say you're not going to offend us. You can share with us and discuss with us what's happening for you, and we'll be able to support you. So how we start it is with a welcoming tone, and that's not just on site, but that's in all of our communications. So it's less clinical language. What we're getting over to people is, when you come here, you're going to be safe. We're going to look after you. We care. You're not just a number. And we do that with really friendly, warm, open language. And that's then continued when they come on site with all members of staff. It's a welcoming environment. As I say, it's not a clinical environment. It's a nature reserve. It can be chaotic. We make a point of sharing that with people and explaining to people and showing them that we're fallible as well. Sometimes, things happen on site. We're not in control of that. We have a local nature reserve that's open to the public all the time, every day. So we show that with our communication, that we're welcoming, and we're normal. We're normal, and that they're welcome. We take away some of the mysteries for people. So something that we wanted to do was, we were aware we'd got a lot of neurodiverse people coming to our programme, and part of what we wanted to do was take away any of the uncertainties for them in terms of what they could expect. So I started to put together a document in terms of like an induction document, and because co-creation is a big part of our service, I then put it out to our participants and said, with quite a lot of pride, what do you think about this? And they very honestly told me it was rubbish. They wouldn't read it. There was far too much text, and they took it out of my hands and created an amazing document. And it's very much what they would want to know. So I thought I knew what they might want to know. It turns out I didn't. They wanted to know things like, what happens if I'm late? My bus is running late. I've made the effort to get on that bus. It's taken a lot for me to get out of bed to come and try and get to you. I really want to get to you, but I'm going to be half an hour late. What happens? Am I going to be in trouble? Am I going to be allowed into my group? And they wouldn't know. They wouldn't know that as a new person to the community and to our program. So we put all that in the document, and we made a point of saying, for example, you're welcome. It doesn't matter how late you are. You can come 10 minutes from the end of the session. We'd rather see you. If you're having a bad day, and you're not going to be able to engage in the group, we'd rather see you. Come along and be part of our group. You'll go away feeling better. They wanted to know things like, if it's a rainy day and we're coming to the nature reserve and we know you're going to get us going out for a walk on that nature reserve, come rain or shine, do I need to buy anything? Do I need to buy waterproofs? And things like that I hadn't considered that they would need to know. But they told us, and it all went into the document. So making sure that we asked the people that use our service what they wanted to know, what would be helpful to know, and then letting them run with it and produce a document that they would want to read was something that we've done and that we're really quite proud of. They've chosen the photos that go in there, and the tone is, again, warm and friendly, and it's all to take away, say, those uncertainties and any anxiety around joining a new service. And particularly when people know that this service has been running for some time, I think that can be quite daunting as well, to join something new. So to make sure that they had access to this was something quite important to us. We've also made sure that we have our staff are accessible. We've got really clear points of contact. people know how to get hold of us. It's not a secret. Our numbers aren't a secret. Our emails aren't a secret. They can access any of us. If somebody had an issue with me and found that I wasn't the right person, they could access somebody else in the team, and that flexibility is important to us. Also, that, as I've said before, that flexibility in terms of mentoring and offering that mentoring support. If somebody's struggling, we try to be able to offer it quickly. When they're struggling there and then. So we make a point of, being able to see people, being able to offer that kind word, that listening ear, and that quiet space. We've embodied an embedded flexibility into the programme, and that's including with our staff recruitment. We're all professionals, but what we wanted more than anything was people who would be able to work in the way that we work and who could offer that flexibility. It's very hard to work in that way. It's very demanding. We don't know how people are going to present on the day, and we meet them as they are on the day. They don't get turned away. That level of trust is important, and that relationship is important. We know our people very well. If somebody turns up unexpectedly, they generally are there because they need to see somebody. So being able to respond flexibly to people in that way was something that we've been key to our recruitment process, really. It's something that is valued by our staffing team as well. So as well as our tutors. So the feedback that we get from our staff is that person-centered approach that we offer to our participants is something they value. The care that's within the team, the care for each other, is something that it's not just extended to participants, it's extended to staff members and to tutors. The feedback that we get from tutors is that the support they receive is second to none, and they feel part of the community, and that's something really important to us. What we do is hard. The people that we support are often quite high level need and often have very challenging circumstances. So to be able to offer that care and support to each other is important to us. That extends to, in terms of our staffing team, we have people across our staffing team who have lived experience of mental ill health. It's invaluable to our participants that we have that across our staffing team. What we say to our staff then is, this job's hard. You're coming with your own things as well. It takes a lot of energy. It's quite hard work to be alongside some of our groups and some of our participants. So we say to our staff, if it's not happening for you today, if you need a little bit more support yourself, there's no judgment in that. We'll cover that. We have those really open and honest, frank conversations around mental ill health within our team as well. So that what can we do for you doesn't just extend to participants, it's also our staff. And we find that our staff respond really, really well to that. We also offer community engagement and outreach, so we're very visible within the community. We have an active social media and also a lot around word of mouth. So we're very visible around the city. As I've just said, we have our green corridors work. You might have seen, if anybody's in York, you might have seen the wildflowers on the city walls. That's us. So we're doing quite a lot around the city to promote who we are and what we offer. And we're always there to engage with people, within the local community. So how our strategies for engagement and how we've done this. So we've developed partnerships. We're working with local GP surgeries, schools, a lot of organisations across the voluntary sector. It's not we're quite keen in terms of working collaboratively, not in competition. So it's very much, what can we do? What can we do for you? So, for example, be it young carers, be it homeless hostels. It's how we can try and best engage with those communities, and we find that works really well. It also works really well in terms of multidisciplinary teamwork. So a lot of our participants are also being supported by different organisations, or different organisations are trying to engage with our participants. We've built relationships with those participants, and we are trusted by those participants. So we can then extend that further out to other organisations. So be it community mental health teams, be it adult social care, we will offer that space and that time at St Nick's to for those organisations to build that rapport with our clients where they need to, and we'll facilitate that. We'll bridge the gaps for those people and for those organisations. It's better for our participants, and it generally means that those relationships will go a little bit better, be a little bit easier. And we can show, because we know our participants very well, sometimes they're attending 2 or 3 days a week, and they might have attended for many years, sometimes up to 10 years with us, because we haven't capped the length of time people can be supported. So we can present that person as a whole person, the person that we've got to know, the strengths that they have, the different sides to them. And as I say, we will offer meeting space and time with our participants and staff. And that tends to work very well, partly, like I say, because we know them, but also coming onto the nature reserve is really positive. We know our clients will feel relaxed coming on, but also we tend to see that with other practitioners as well. And that's the beauty of having the nature reserve and the outdoors, I think. So we've been working hard to build a brand that's known to people. So that's our charity, the environmental side of things, what we do, but more than anything for us on Ecotherapy, it's that person-centered approach. So we make a point of getting that over in all our communications, and how we work with people and organisations. We have the space in the reserve open to the public, so the local nature reserve is always open. That comes with its own challenges. It's in an area of York where we have some levels of deprivation, and we work quite hard to try and engage that community, show them what we're doing, and show them that it's for them. That space is for them, but also ecotherapy is for them. We do a lot of outreach work. We do a lot of things like festivals. We attend events. It might be involvement and engagement events. We'll try so we have a lot of community engagement in terms of different organisations that have a vested interest in us as an environmental charity, and we'll work hard to try and put on events for those organisations, and also other organisations that where perhaps they may not feel that green spaces are for them. There's considerable research to show that minority ethnic groups don't feel that green spaces that are for them, that they're welcome there, and we're working really hard to try and challenge that and make people feel included. How we do it as well in terms of engagement is we give regular updates across our service, but also on our social media. So we're letting people know what we're doing, and we're making it as open and as transparent as we can. And again, people across our programme and our service know, and they've come to expect that from us. We'll tell them what's happening. We'll tell them openly what's happening with our funding. We'll tell them openly what's happening in terms of our service, if we're making a change, why we're making that change. There's no hidden agenda. That if we're making a change, it's generally for a good reason, for a positive reason. It may be related to feedback. It may be because we've decided to try something new to see how that sits, but we'll tell them. We're very open with our participants, and we will explain what we're doing and why we're doing it, and have quite robust conversations around it. So this is about measuring impact, and this is something I feel really strongly about. It's quite important to me. So I feel really strongly that if we're asking people for their opinions, for their feedback, it should be a positive experience for them. It shouldn't be to their detriment. We've had participants tell us before that when they've used, for example, tools such as the Warwick Edinburgh, this is really harmful to them. It makes them feel really bad about themselves. It makes them feel really bad about where they're at in their lives, that they haven't made enough progress in their lives. They're still struggling with the same things that they've been struggling with for maybe 20 years. And I didn't want that for us for measuring impact. We have to measure impact. We have to feed back to our funders. But I wanted it to be positive. I wanted people to be able to feel positive about engaging with it, and feel that it mattered them sharing their, what they wanted to share. And I wanted them to go away afterwards feeling good about giving feedback. I didn't want them to feel bored by giving feedback. We're aware that everybody gets asked for feedback all the time. I wanted it to be positive, not to be tokenistic, to get over that barrier of feedback fatigue. And I wanted them to feel, like I say, that it mattered, that what they had to say mattered. I think particularly with our client group, often they have felt that their voice is unheard, that they've been done to, they've had services they've been forced into, they've had their stories shared without their consent, and I wanted this to be different. I wanted it to be their opportunity to really tell us what they feel, what they think, and what's important to them. So we ripped it up and we started again, as I've put there, and we went back to our client group and discussed with them what it would look like to have a meaningful process for them, a meaningful tool. We wanted it to reflect us as an organisation, so bearing in mind our environmental values, the fact that we're voluntary sector, so we can try different things, we can be innovative, we can have a go at stuff, and see what happens. We're also quite this might sound a bit weird, but we're quite playful at St Nick's. We have a lot of fun. So to say we're offering a mental health program, we have a lot of laughs, and that's something that when I started I was really keen to ensure that we had. Mental health is just a part of who that person is. So I wanted it to be playful as well. I wanted it to be accessible to everybody and inclusive. So I wanted it so that if somebody, if literacy is a challenge for them, that was okay. That didn't matter. They could still tell us how they feel about the service and what it means to them and what they wanted to change. So I also wanted it to be that if they weren't having a great day, and they didn't want to write reams or didn't want to score it, they could also have that option to tell us in a different way. So I'll share with you the tool that we created shortly, but a lot of thought went into the design of it. And as a result of that, the engagement with it is good. It's positive, and we have a lot of responses. to that measuring tool, which we then link into our CRM. We capture all the data and we link it in. It's not the only way, though, that we capture feedback. We do it through using videos. We do it through using content from the sessions that we run. So we have sessions that might be people writing poetry, creating art, and we use that with their consent. And that's really impactful. The videos also are very, very impactful. And again, it's they're celebratory. So people are incredibly proud to do this. Like I say, going back to the fact that often they've not had their voice heard. So then to be asked, would you want to create this video? Would you want to share your story and what this means to you? You know, is really quite powerful. I'll give an example of that. So we have a participant who can't join any of our groups. It's too much. We've been supporting that participant for 3 years, and that participant won't be able to sit in a group. It's not going to happen. So we've created a volunteering role for that participant, and that participant can come and make hot drinks for the groups. It might sound meaningless, really, but it's not. It's a really big deal for that person. It's the only positive thing that person's got going on in their life. It means they get out of bed. It means they've got something to do in the week. And it means a lot to that person that we've created that role for them. That person knows I could make the hot drinks myself. I make many hot drinks every day. I'm notorious for filling the dishwasher. I'm always making hot drinks, but 1 day a week I have somebody who comes along and that's their role, and that gives them purpose. That person struggles to communicate with other professionals, struggles to communicate with our staffing team sometimes. But I asked them if they wanted to create a video. They'd written a piece for us as to what it means to them. And they then recorded that for us. It took 5 attempts to record it. It was incredibly hard. That person nearly gave up numerous times. But we had a chat around it. We talked through how to do it. We talked through the nerves that I experience when I'm delivering, and how I get around those. And she got through it. That person got through it, recorded it, and the pride that person now has in having done that. She shares that with a lot of people. And it's in our reporting. It's there, it's something we're proud of as well. It took a lot to do it, and it took a lot to get to that point, 3 years to get to that point of being able to record that. So we use things like that, and they're really powerful. They're really impactful. Another example is of somebody who likes to create raps in our art and creative writing group. There's often a rap, and they are just incredibly joyful. And we, with their consent, we record that, we use that. They love it. We dance to it. We've shared it with our funder. I can't imagine that our funder is not dancing and not got the biggest smile on their face when they get that recording. I would have. So the boring stuff, we monitor session attendance, participation, repeat participation, and progression through volunteering. So if somebody's not attending, we're asking them why, and it's not a why aren't you here? We need you here. It's coming from a point of view of caring about that person. What's happening for you? We notice you're not there. You've missed 2 or 3 weeks. Are you okay? What can we do for you? What can we make it work for you? Do you just need a breather for another couple of weeks? Do you need a chat? Do you need to come in and see one of our mentors, have a conversation, start building back to it? Or is there something going on that actually you need support with? You need us to signpost with, you need us to make that phone call for you. So we do monitor attendance, and we do feed that back into our CRM, but we're doing it as much as anything from a point of caring for that person. We know those people, and we know that if they're not attending, there's often a reason as to why they're not attending. We monitor progression into volunteering roles and other roles in the community. For a lot of our people, that can feel absolutely unachievable when they start. But it's amazing that as their confidence grows and they start to, their self-esteem starts to grow, and they're recognised as the fabulous human beings that they are, that are coming, that they start to branch out a wee bit, and they will go into volunteering and other community roles, but also into paid work as well. Even that can feel beyond the person when they first start, but then to have them come to us and say, actually, I think I can do a little bit more, and I'd like some help with looking at that. That's amazing. It's not for everybody, and that's fine too. But we do monitor that because that's fantastic to see that person grow. So the mentoring, we monitor the outcomes with regards to mentoring. That mentoring is a safe space, and we're building up trust and rapport, but it's also good for us to see what's happening for that person, where they're going on to, what they've used that mentoring for, and how it's built that confidence for them, to be able to move on in different ways. We also let participants know the reasons for feedback. So we create that safe space to be able to share feedback. Our participants know that they can give feedback in a variety of ways. They can just collar us on the nature reserve. They can just collar us at the environment centre, and they can have that conversation. Nothing bad's going to happen as a result of that conversation. Far from it. We show that to our participants. If they share with us, if they've taken the time to tell us what they think and how they feel, and if something's not right with the service, we thank them. It's important that they do that. It's hard to do that, and especially when you've kind of not had your voice valued before, to show that they can come and they can share with us what they think, and we will listen and say, quite often say, actually, you've got a really good point. Thank you for that. Because it's different voices to our own, rather than being in an echo chamber, really. So those different voices are so valid. We did it with we do a retrofit of our building. And we asked our participants, what do you think? What should we have for our new building? And the feedback that we got was amazing and insightful. We're doing it currently for our service development. We've asked our participants, what do you think should be in this programme? Our chief officer was really surprised. She thought everybody would just go, oh, we love it, don't change it. And they didn't. They told us very frankly and honestly, and they said, what they wanted going forward. And we feel really, really proud that people trust us enough to say, actually, this is what I'd want. This would help me. And they know that they will be, they'll get a good response. So this is about our tools and methods. So we have an initial referral. That's where we collect the initial data at point of entry. That's an online referral. It doesn't have to be online. We're aware that some people can't access things online, or that they would be put off, they'd be frightened, they'd find it very anxiety inducing, and that's okay too. So we don't mind how that referral comes in. We don't mind how somebody comes to us. They can turn up at the gate. Their mum can phone. It really doesn't matter to us. And if somebody can't use IT, can't put that referral in, or a social prescriber can't do it on their behalf, we'll just meet with them, and we're quite happy for our onboarding process to be flexible. We know that if somebody's coming and they don't know us, and they're being asked to share their information about their life, why would they trust us? So it's okay for them just to come and meet us, to come and meet us and see what they think. And invariably, they'll say, actually, I feel okay to do the referral and the assessment now. But it's also okay that they don't feel okay to do that. I feel quite strongly that, particularly with people's lives and their personal information and their really the hard things that they might have to share, that that's really hard to do with somebody you've never met, and asking you really personal questions. So we're okay. We're okay with saying, just come and see us, come and meet us, weigh us up, and then see what you think. We do pre and post surveys, so we use our tool, our measuring tool, at point of entry and then throughout their journey, and then also at point of exit. We look at attention and retention data, and we store all that in our CRM. So that means when we get to the dreaded reporting, we've got loads of fabulous infographics. We use a system called Charity Log. We pay for that system. It's fantastic. Well, but I find it fantastic, and I'm not very IT literate. So if I can use it, anybody can. So we use Charity Log. It helps us track our participants. It helps us manage risk. It helps us keep on top of our GDPR. And it also it's just useful in terms of being able to go back to when people did join, and what they were coming for in the first place. So that's how we manage our data. And like I say, when it comes to funding, we've got some fantastic infographics, because we've put that data in and we can just pull it off, and I think it looks stunning. We use participant stories and testimonials. We invite people to come to us. It's all invitational. Sometimes we'll know that people have got fantastic stories and case studies, because we know our people very well. So we might ask them, would you feel comfortable in sharing this? And like I say, because we've created that safe space, and that trusted relationship, they invariably do. Like I say, we use art, journals and photos to showcase what we do. And we also use staff and volunteer observations. So we will, we meet regularly. We make sure as a team that we, each week we have a discussion around our groups and our participants, see if there's anything that's changed. And we also invite our tutors, our freelance tutors, to feed back into that as well. And it just means that people aren't having to tell different people the same thing all the time. They know that that if they go to a member of staff, that member of staff will know where they're coming from and will be able to support them. This is our evaluation tool that we created. It's supposed to be a spider's web. So off of each of the little bits is the things that we think we do, and what we're measuring. So again, we went back to our participants and we actually said, what do you think we do? We know what we think we do, but what does it actually mean to you? What do you get from it? What should we be measuring? What is the actual impact? And again, it was a little bit different to what we thought it was. And that was quite good. So we used a spider's web, thinking it was environmental and playful. When they look at it, they're smiling already. Oh, it's the spider's web. Here we go. They can colour it, they can score it, they can write on it, they can get us to write on it, or they can just tell us. And it doesn't really matter to us. As more important is that they give us that feedback, and we can use it both for their well-being, but also for our service development and for our funders. So the feedback loop. So what we do is we ask them to do this, and then we show them that they've been listened to. We act on it. If we can't make a change, we're explaining why we can't make that change, because sometimes it might be unrealistic. Sometimes there might be an organisational thing that they don't know about, and they shouldn't know about. That's we have things as a wider charity that we have to adhere to. But where we can, we act on it. We show that it matters, that what they've shared with us matters. So, for example, one person that attends shared with us, when I come, you ask me, how are you? And he said, I don't like that. That already makes me feel bad. I want to come to the session. I want to feel good. When you ask me, because I'm neurodiverse, I'm going to literally think, well, how am I? I'm not very good. I'm having a terrible time. And then I'm going to start thinking about all those things, what's making things hard at the minute. And that person gave that feedback. We shared that within our team. And that person is now greeted by members of staff who say to them, nice to see you. And that person said to us, the difference that has made is immeasurable. And that was really powerful to hear that. So we make a point of listening. We know our people, and then we act on what they tell us. That's just a small example, but that example is quite powerful for that person. And it's quite moving for us as well, to be honest. We use data to adapt and improve the delivery. So we're really clear that whilst this is our program and we think it's good, there's changes that we can always make. There's ways we can improve depending on what we've been told, and we should be doing that. That's important to do that based on what we've been told. We also celebrate the success stories publicly. So as I've said, we share what we've been doing. We share the good stuff. We try and get that out on our social media. This is what we've been doing, and we hope you enjoy it. And we get that really positive stuff out there. We also share the findings with participants and partners. So we've recently done a service development consultation, and our participants said, well, we've shared back from our group and from our point of view, but what's everybody else said? And we've shared that back across the program, and that was so useful for our participants, so interesting to hear what other people were saying, and sparked a lot of discussion, because you only know what you know, don't you? And you don't know what other people are thinking and what point of view they're coming from. So that was really useful for our participants. So this is our conclusions and what we've learned in terms of trying to make our service as person-centered and strengths-based as possible. So the big thing for us is looking at the barriers to accessing the programme and ensuring that all the different voices are heard. And that's really, I can't stress it enough, it's those voices that are quiet, that where they won't share, that we really want to hear. We want to encourage that positive, safe space. Like I say, we're starting from a point of view of, how can we make this work for you? Rather than you fitting our service. So we're flexible and we're open to change. And that's, again, key to our service. We're working really hard to open nature up to people who wouldn't necessarily feel it was for them. That's also extended in addition to minority ethnic groups. It's also to those people who can't get to us. I feel really strongly that, we've got our core participants, but there's so many other people who can't get to us. They may be housebound. They may be living out of our area, but they still want to be able to connect to nature, feel the benefits of connecting to nature. So we're working really hard at trying to do that, to give people that opportunity to connect to nature. And that's something that you may see going forward more and more from our social media. So we make sure that the measuring impact is meaningful for participants. It's not tokenistic. We want to get over that fatigue. We don't want people to think, oh, here we go again, and nothing ever happens when we've said what we think. Sometimes that's really hard. It can be very frank. It can be very robust conversations. But if we've asked people what they think, we should be kind of big enough to take it. And also, like I say, to challenge as well. We don't just want to hear the good stuff. We want to hear, when we're not hitting the mark, and where we could do better. We offer the opportunity to give feedback in a variety of ways. We've got some people say, I'll tell you what you want to know. I'll tell you what I think, and you can write it down, and that's okay. That's okay. We just need to capture it. We ensure that measuring impact is positive. I think that when people are coming to our service, they should be having a positive experience, and that should be across every aspect of our service, including giving feedback and including the assessment process. It shouldn't leave people feeling bad and feeling sad or traumatized. They should come, go through assessment, give feedback, and go away feeling positive, and that's been useful for them and a good experience for them. So just explains where we use the measuring tool at point of entry, and then regularly to review and at exit to show the journey. We ensure that what we're measuring is what we're actually doing rather than what we think we're doing. As I say, we encourage open and robust conversations, and then we act on the feedback, because if we act on it, then they'll give it again. If we don't, why would they bother? I wouldn't. So we make sure we act on it.